After the next talk, we will have some discussion. So Dr. Reena, Chief Instructor, is going to talk to you about another off textbook topic, art of ethical decision making in complex clinical situations.
Thank you, Dr. Mahesh. Decision making is an art by itself, and like any other art, it has to be practiced to be perfect. So, what do you mean by ethics in medicine? And it's actually an inherent and inseparable part of medicine because we are supposed to be healers, no? So, then it has to be done in an ethical way. So when ethics in general it's a philosophy based on moral foundations. But when these values and morals are added to human activity or any life sciences, it is called bioethics. There are so many sub categories. You may be familiar with research ethics and medical ethics. But what we are concerned today is about clinical ethics, which will help you in reaching a decision when we are facing with a difficult clinical situation where there are more than one answers. Now we know that there is an interplay between ethics, medicine, and law whenever you deal with it. But there are many areas where law is silent. You don't know. There are no proper guidelines, or law is not giving you a clear direction what to do. So these gray areas, whenever you are facing with, ethics forms the basis of next decision making. So, in practice, any good clinical decision making is based on your scientific knowledge and your ethical reflection. Scientific knowledge, we usually rely on evidence based medicine. What do you mean by a complex decision making situation? So, whenever whatever you are choosing, it goes beyond a therapeutic intervention or a treatment. More than that, you are considering so many other factors also. Then that situation is a complex decision making situation, and these are the situations where ethics plays a very big important role. And why this is important? Because most of the time the patients finally will tell you, doctor parayana pole madi. So doctors will be forced to take these kind of decisions whenever things are a little bit complex. And in most of those occasions, whatever legally or scientifically correct need not be morally acceptable to the patient or to the doctor. So there are some gray situations. So based on your medical knowledge and ethical considerations, you take the decision, but in a complex situation, you have to give all importance to patient preferences. What your patient wants, that is more important. And most of the time, we as doctors, we rely on our medical information to take a decision. But there are situations where you will think, did I do the right thing in this? When it happens is most of the time when you result in a complication, you made a wrong decision or something went wrong, or when your whatever you're offering is not a curative one. So if there are many options in treatment choices, then also this similar situation comes. So in such complex situations, is there any guideline or a flowchart based on which you can take these kind of decisions? So these basic pillars of medical ethics remains the same. So this has to be there in any decision making. So doing good, we all know that it is the most important thing, and doing no harm is more than the important. And respecting patients' choice or autonomy is the third important factor. And it has to be having a distributive justice, that you have to do that same to all patients. Now, when you're faced with a given situation, you have to ask these questions. What is possible in this particular situation? What is the appropriate thing to do? What is permitted by our guidelines and whatever is available? What is the risk benefit ratio? And what is commonly practiced among our peers? So, these questions, if you get some kind of an answer, that will help you reach a conclusion. Now, we may think that are we facing such complex situations in ophthalmology, like in maybe we are not dealing with end of life decisions, or maybe cloning and all those reproductive medicine complexities and all. But in general, everyday practice, there are so many situations where you knowingly or unknowingly use ethics. So, whenever you decide which eye to be operated first, when there is an associated complication, ethics is playing a role. A patient who is having an advanced field loss, he says he's a driver by occupation, or he's driving a car, will you give an advice? So that also considers ethics. But when if he says that he's driver of a school bus, then again it becomes a little bit more complex. So then always there will be situations where you will be encountering privacy and confidentiality issues also. Now, as an example, this is something which I faced once. This situation there was a mentally unstable young lady. The family wanted her to become pregnant. They stopped the antipsychotics. She became aggressive, self-mutilating, and at that time she presented with a totally injured cornea with total UVL exposure and very, very aggressive behavior. 16 weeks pregnant. What will you advise? Do you advise medical termination and do a surgical intervention, which is scientifically the correct thing to do? Or is it, according to their wish, you will let them continue the pregnancy with a conservative management with the risk of bleeding at any time? Another situation, this is in a medical board. The young girl, 17-year-old, she's having a disability certificate with more than 40% disability, pathological myopia, nystagmus, head position, very poor vision, 3 by 60, 2 by 60, something like that. But she has qualified for undergrad medical admission. So you are in a medical board to decide whether this girl is fit to go for the medical course. So what will you advise in such situations? So there are no hard and fast rules what you should do or what you shouldn't do, and you know that there are more than one answers, and you have to consider the patient factors, what is relevant to that particular situation. And the most important thing is that you may be having a lot of biases and conflicts within you. You may think that I was an undergraduate student and I was normal or normally abled. I found it difficult. So, what about this girl who is having a 40% disability? So, those kind of biases and conflicts should not be there. So in bioethics, there are a lot of ethical frameworks which are available as flowcharts and other things. But the important point here is that whatever available guidelines and SOPs are there in regarding that situation in your science, that takes a back seat. And what is considered more is about the ethical values in such situations. So these are some of the examples of decision making models. Always you consider the facts and the stakeholders, you discuss, negotiate, and then finally among the whatever choices you get, you pick the optimal choice for that particular situation. And an important point, whatever you consider, that should have a moral reasoning which you will be able to explain. And whatever decision you are taking, it should be within the policy guidelines and governing laws what is available in the city, because you cannot do something which is totally away from that whatever medical directions are. So you have to find the most acceptable one, but with a moral reasoning. Now, just to that we all are aware that ethics has been introduced as a subject in medical curriculum for undergraduate teaching. Why this kind of a decision by the medical council all of a sudden? It's only because they also felt the importance of having an ethical thinking in the medical graduate. It's basically because of the loss of trust, and trust is the most important factor that helps a patient care and doctor relationship. And the younger generation or the older generation also, they many times we all focus on the skills and the learning and all those higher qualifications, but we give no importance to the professional aspects of in building up an empathetic relationship. So all those things, the good communication, all those things are often ignored because where they are equally or sometimes more important in many of these situations. So all these together, the NMC has also thought that ethics has to be introduced into the curriculum, and now it's a subject, and we are all supposed to teach students, undergraduates, on ethical aspects of different situations. Disclosure of a medical error, you made a mistake, how will you tell the patient? Nobody is teaching us. So what is the goal? So they are trying to give to give students an idea about ethical dimensions in a patient care situation, and also they should have familiarity with the all ethical pillars, whatever I have been explaining. And these core ethical competency they have to develop, and whenever they are exposed to a situation where there is a complexity, they should be able to take a ethically acceptable decision. And then finally a medical graduate Indian medical graduate will become an ethical professional. That is the ultimate goal with all these characteristics. But what is the irony here? The irony here is those who are supposed to teach, they never got any exposure to ethics in their curriculum, their academics, or maybe they are not even practicing it there in their practice. So how far these things will make a change, I'm not very sure about. So to summarize, it is you always have to follow the ethical principles, which is doing no harm as the most important thing, and you should understand that there are no right answers for a given complex situation, but you have to choose the best for the patient at that particular moment for that particular patient, with a moral reasoning and a proper clinical judgment. That is all that is possible. So find your balance.